And joining us now for more on FEMA and other issues, including his legislative push to make it easier for gig workers to access employer-insured health care, Republican Senator Bill Cassidy of Louisiana, chair of the Senate Help Committee, is joining us live from Capitol Hill. Senator, we do want to get to the Unlocking Benefits for Independent Workers Act, but given the unfolding disaster still in Texas, knowing you represent a state that is no stranger to natural disasters, what does it reveal to you about changes that should or should not be made to FEMA?
Well, the disaster in Texas, which is awful, is a relatively contained disaster. The problem is when a Hurricane Katrina hits and New Orleans, Louisiana, Mississippi are all devastated. That's when it becomes difficult to imagine that the two states pulling it off by themselves. By the way, FEMA can be reformed. You can make it a lot better. You can save money the way it's currently conducted. On the other hand, I don't think it's possible that a state like Louisiana and Mississippi, those states could have responded on their own. As one example, there were helicopters being brought in by the federal government to evacuate people out of New Orleans when it was all flooded. I'll also go to another example. I once toured the Oklahoma City bombing site. I know that the federal government brought in teams from across the nation to help look for survivors beneath the rubble. Oklahoma won't have those, but the federal government can have a coordinating role. So FEMA can be changed, it can be reformed, absolutely, but let's not forget that sometimes the response is going to require something more than a state has.
I'd like to ask you, Senator, about something else that may or may not need changes. The rescission package currently being considered in your chamber. Will it require tweaks to what the House passed in order to actually get the requisite votes?
Yeah, so I haven't studied it in detail yet. You know, NPR, that's a layup. You know, NPR, it's partisan. Its CEO is clearly partisan, saying terrible things about President Trump, and it's supposed to be nonpartisan. And some of the other stuff we have to look at carefully. I am all about getting waste, fraud, and abuse out of the federal government. Let's just do it. Let's just do it right.
Well, Senator, let's get into your gig worker benefits bill, which is something that I know you're working hard on right now. The Unlocking Benefits for Independent Workers Act would basically allow independent contractors, gig workers, as we call them, to have portable benefits, health insurance, retirement benefits, paid sick leave. As I understand this, and correct me if I'm wrong, this would expand what they call association health plans that a number of different employers would pay into. How does this work? If there's no mandate, how do you compel companies, employers, to fund this coverage?
Because the employer is competing for the better independent contractor. They have a choice of where to work. They can be a DoorDasher, they can work for Uber, they can work for Lyft, or something different. And so this would be a package that the company would offer proactively to get the better employee, not employee, specifically not employee, but rather independent contractor. And companies have stepped up that they want to do this. The DoorDash people have gone to states attempting to get a safe harbor for them to provide these benefits. So we can see they want to do it. And by the way, the independent contractors, they like being free, they like being independent, but they'd also like the benefits.
Is the hope that this in part would lead to coverage for gig workers who might lose it under the president's big, beautiful bill?
Well, no. Right now they can go to an exchange. And there's no reason why a gig worker should lose benefits under the one big, beautiful bill. That's kind of one thing that the left is pushing out there. No reason at all. But on the other hand, it'd probably be a pretty nice group to insure. The premiums would probably be less than the exchanges, and it would go along with the kind of, they're an independent contractor. It gives the worker a choice. They can have the freedom to move locations. At the same time, they would get the health benefits in the 401k that right now some of them feel compelled to stay with an old-fashioned employer, if you will, as opposed to their new system.
Well, Senator, because of the One Big Beautiful Bill and the people who will lose coverage as a result and who are upset about that, are there Democrats willing to work with you on this particular piece of legislation through regular order?
Let me push back. You're suggesting that there's going to be all these people losing coverage. Let's speak about the people who are at risk of losing coverage.
The Congressional Budget Office says there will.
So let me finish. If you talk about someone who's 18 to 64, able-bodied, not disabled, able-bodied, without dependents, then yes, and they don't work, volunteer, or go to school at least 20 hours a week, they can lose their coverage. But I think most Americans would say, and I as a doctor who worked in a hospital for the uninsured for 20 years, hey, you're getting free health insurance. You can at least work, volunteer, or go to school 20 hours a week, and if you do, you will be healthier. Statistically, you will be healthier. And so I'm going to push back a little bit. In fact, I'm going to push back hard on the fact that all these people will lose coverage. If they work, volunteer, or go to school 20 hours a week, they can keep their Medicaid. Now, on the other hand, can we do stuff on health care that would be bipartisan? Absolutely. There are things that both sides agree on that would preserve benefits for somebody on Medicare, for example, but preserve the program longer by cutting out waste, fraud, and abuse. And there's bipartisan bills to that. I think we should work together for that.
Senator, I only have a minute left. I don't want to set you up to cut you off, but where's the opposition on this? Is it teachers' unions?
In terms of the independent contractor?
Is it unions of any sort, for that matter? Is it organized labor that you're fighting against?
Two things. We hear that both unions don't like it because they don't want to kind of update labor laws from 100 years ago to make it better for the independent contractor. And secondly, it is, I'm told, some old-fashioned businesses that know that some of their people stay employed because otherwise they lose their benefits. We're trying to update those laws with our focus on the worker, not on the unions, not on the old-line business.
Well, come back and talk to us if this gets across the finish line. Republican Senator Bill Cassidy of Louisiana, we look forward to our next conversation with you here on Bloomberg TV.